At the bright side here. President Obama looking to salvage his bid for health care reform with a speech before Congress that's coming up on Wednesday. White House Press Secretary Robert Gibbs talking to the Sunday talk show circuit today, and he said the president will do what it takes to get a bill passed. Watch.
We're going to certainly, I think, as I said, people will leave that speech knowing where he stands. And if it takes doing whatever to get health care done, the president's ready, willing, and able to go do that.
But Gibbs refused to say if the president will veto a bill that doesn't include a government-run option.
I doubt we're going to get into heavy veto threats on Wednesday. We're going to talk about what we can do because we're so close to getting it done. He will talk about the public option and why he believes and continues to believe that it is a valuable component of providing choice and competition that helps individuals and small businesses, at the same time provides a check on insurance companies.
So what kind of compromise is needed? Joining me now, Congressman Michael Burgess, a Republican from Texas, and Democratic Congressman Jerry Nadler of New York. Great to have you guys here today. Appreciate it. Well, first of all, before we start and ask you what kind of compromise is needed, I want to know if you both think that this is a good idea for the president to have a speech and to address Congress on Wednesday. Mr. Nadler, you can go first.
Well, I think it is a good idea. There's been so much misinformation and hyperbole and falsehoods about what it is, what people are proposing, that I think it's a good idea for the president to get up and say, look, what we're proposing is essentially a continuation of the present system, employer-based health insurance, a mandate for employers to provide health insurance if they don't, or pay a tax if they still don't want to do that, subsidies for low-income people, and for people who do not get employer-based health insurance, because they're self-employed, because they're unemployed, whatever, the option to go to and buy in a government-regulated marketplace, buy health insurance from private insurance companies at group rates or from a public option as one of the options. And that's all that's being proposed. No government takeover of health care or anything else. And let him outline what's being proposed and why it's being proposed, and the debate can proceed from there.
Representative Burgess, what do you think?
Well, I think it's a very high-risk strategy for the president.
Why?
I obviously disagree. Well, he's certainly there on the table. I agree with Representative Nadler on one point. The president will sign a bill. He's not going to move away from this, and at some point the White House will declare victory with whatever's on the table and call it their own and sign it and declare victory. But this thing on Wednesday night, it is a high-risk strategy because the country has rejected the president's policies over the last 30 days' time. They, I do not think, have taken the time to build from the grassroots up the consensus for the type of change they are trying to implement, and as a consequence, people are dissatisfied. We'd do far better if we broke this down into some of the component parts and tried to work on some deliverables for the American people. Things like pre-existing conditions, things like fairness in the tax code, things like true competition, like being able to buy across state lines. These would be things that the American people could understand where the Congress really is trying to help. Right now, no one thinks we are, and unfortunately, the president apparently is embracing that and going to try to take it forward.
Well, speaking of, you mentioned the American people. Go ahead, sorry.
No, I just don't think that this is the correct format for the president to recapture the public debate. I think we need to show utility on some of these things first, and then come back to the American people with some of these ideas. We're trying to do this whole thing from the top down, ram it through, get it through fast before it has a chance to look at it, and people are rightly looking at us askance and saying, what in the world are you trying to do?
That brings up something that I wanted to talk to both of you about. We have a lot of folks, obviously, who write into our website, partisan, bipartisan, or Republicans, Democrats, Independents. A lot of them say, they're doing sort of the armchair quarterbacking, but a lot of them say, maybe the way to go here is just to sort of move incrementally. Go with the gimmies first, the things that are bipartisan, that will get support from both sides of the fence. And then once those things kind of go through, then you sort of have, you start to associate Obama health care with something palatable and positive. Everybody feels this way. And then you can start kind of pushing in the less palatable changes maybe for some people. Your thoughts on that, Representative Nadler?
Well, I think that we've seen from Senator Grassley and others' remarks that most of the Republicans won't buy into any major change, and we've been doing incremental health care improvements for the last 20 years. That's what SCHIP was about, to extend health care to lower income children, etc. But the fact remains, we've gone from 37 million unemployed to from 30 million to 47 million unemployed in the last since 93, in the last 18 years. The fact is that lots of people who think that 55% of all people today who go bankrupt because of health costs, and 75% of those people thought they had good insurance, and it was good insurance until they needed it. So we have to solve that problem, and now is the time to solve it. And frankly, there is a way you could do incremental change if we simply said, okay, we'll allow people 55 years and older to buy into Medicare, and 10 years or 5 years from now, people 45 years for older. That would be incremental change, but the Republicans are not about to agree to that.
Let's get your response, Representative Burgess, and then we've got to go.
Well, if the president is trying to be bipartisan, they've certainly chosen a strange way to do it. Of course, it's impossible to be bipartisan with the Speaker of the House taking the positions that she's taken. But look, Medicare, come on, give me a break. Here's the largest insurance company in the world, if you will, that lacks a CEO. The president has not put in place the director of Center for Medicare and Medicare Services in 6 months' time. We are floundering. No one's at the keel at Medicare right now, and that's a big problem. You look at all of the difficulties we have in the Medicare system, and many of those are insoluble until you put someone in that position.
I hate to break this up, but gentlemen, we have to go.
Medicare will do that.
Medicare works a heck of a lot better than the private insurance companies.
Representative Nadler, I got to cut you off. I'm sorry. I apologize. And you were so kind to come in here to the studio. We have a street fair out there. I'm sure it was kind of a nightmare trying to get through that. We appreciate both of you coming in today. Thank you.
But there's some good Brazilian